My name is Robert Martiniano. I'm the Senior Program Manager at the Center for Health Workforce Studies. Today, I want to use the incidence of smoking and smoking-related diseases to demonstrate the functionality of the data guide. As we think about the impact of smoking, there are tremendous healthcare impacts, but New York's don't bear that burden evenly. There are significant geographic differences in the rate of smoking, thus significant differences in the burden of the disease by geography and by region. To explore this more fully, let's first define our research question. Simply put, are there geographic differences in smoking rates and its impact on certain diseases? For this exercise, we are going to compare Westchester County and the Mid-Hudson region to Franklin County and the North Country region. First, we need to review the geography of New York State. Franklin County is on the border of Canada, and the northern border of Westchester County is about 3 hours south of Franklin County. Westchester County also borders on New York City. Let's start our analysis of smoking by taking a regional view of the data. When you first get into the data guide, it starts with region at a glance. As you can see, this regional view gives basic information on the region supported by some narrative on the right side of the page. When you scroll down on the page, you can see other data such as information on education, natality, health status and behaviors, hospitalizations, health occupations, and employment. Notice that the data is presented in both a table and graph form. But for our analysis, let's go back to the top of the page. In the upper left-hand corner of the map, you will see a select box with the word capital in it. You can use this select box to navigate between the regions. Let's go to the Mid-Hudson region. As you can see, from an economic point of view, Mid-Hudson is better off than New York State as a whole. Let's now scroll down and review the health status data. First, we will start by selecting health status and health behaviors. This view of the indicators compare them regionally to downstate New York, to upstate New York, and to the state as a whole. And as you can see from the chart and the graph, the rate of smoking in the Mid-Hudson region is lower than upstate New York and the state as a whole, but slightly higher than downstate. So now let's take a deeper dive and look at Westchester County. To start this deeper dive, we need to scroll back up and go into the detailed view. Since the detailed view starts at the state level, we need to select the Mid-Hudson region. Since we are assessing incidence of smoking, we need to click on the health status and health behaviors text on the left. This view gives us the number of adult smokers, the percentage of adult smokers, and the change from the previous cycle's data. And as we see, approximately 14% of Westchester County's adult population smokes. Using the same screen, we can see the detailed view for Westchester County. Select Westchester County from the county box, and you see that approximately 12% of Westchester County's adult population smokes compared to 14% in the Mid-Hudson region. We can also compare Westchester County to other counties by selecting the details text on the right. We see both in a table form and a graph form the percentages of the adult population that smokes. You can even compare all the counties within a region by selecting the specific region in the box on the upper left. As you can see, Westchester County has a relatively good rate of smoking in adults compared to other counties within the Mid-Hudson region. When you scroll down on this page, you see a heat map of the counties and a chart with the count of counties by the percentage of smoking. As you can see from the heat map on the left, Franklin County jumps out as a county with one of the higher rates of smoking. There are also other rural counties that seem to have a high percentage of its population that smokes. But for purposes of this analysis and comparison, we will review Franklin County and the North Country region. We need to start by scrolling back up to the top of the page and go to Region at a Glance, and then select the North Country. We talked earlier about the narrative supporting the data. As you see with this narrative, smoking was highlighted as an issue in the North Country. Clicking on details under that text gives a little more depth to the narrative. The details in the narrative indicate that Franklin County has a high percentage of adults that smoke, and that lung and bronchus cancer within the region are also an issue. So now let's look at adult smoking rates in the North Country by scrolling down and selecting health status and health behaviors. As you can see, 21% of the adult population in the North Country smoke, compared to 14% in the Mid-Hudson region that we already found. Let's take a more in-depth review and look at the percentage of the adult population smoking in Franklin County. We need to go back into the detail view, then into Franklin County to look at health status and health behavior for the percentage of adults who smoke. As you can see, the rate of adult smoking in Franklin County is more than twice as much as in Westchester County. Rather than going into more detail on smoking as we did with Westchester County, let's take a look at diseases related to smoking. We know from research that hypertension, lung and bronchus cancer, and lower respiratory disease are all associated with smoking. Let's look at lung and bronchus cancer cases, though the process would be similar for hypertension and lower respiratory disease, hospitalizations, and mortality. Staying in the detailed view, we can look at cancer cases for the Mid-Hudson region. We see in the Mid-Hudson region 68 lung and bronchus cancer cases per 100,000, though we do not know how that compares to other regions. By again selecting the details view, we can put the Mid-Hudson data into context. As you can see, the rate of lung and bronchus cancer cases in the Mid-Hudson region is lower than most of the other regions. We can also see that the rate of lung and bronchus cancer cases is the highest in the North Country, though many other upstate regions also have high rates of these types of cancer. Let's take a county level review of this data. We need to go back to the detailed view. We need to select Westchester County in the upper right-hand corner as we've done before, then select cancer mortality and cases. As you can see from the data, the rate of lung and bronchus cancer cases in Westchester is low, but again, there is no context. So let's further compare that data to Franklin County. By selecting Franklin County in the detailed view, we can see that the county has a high rate of lung and bronchus cancer cases, though it's not as high as the North Country region. Let's explore a little more by selecting the details text. As you may remember, the details view lists all the counties. So let's just look at North Country. While Franklin County is high in terms of the rate of lung and bronchus cancer cases, it is lower than the other counties in the region. While we can conclude there might be an association between the rates of smoking and lung and bronchus cancers, we think we need more research to understand other potential causes of this type of cancer, such as radon, working in certain types of occupation, or other causes. From this analysis, we see an association between smoking in adults and lung and bronchus cancer cases. While the data guide answered some questions about smoking and related diseases, further research may be needed to better understand other potential causes, especially in rural areas.